All righty. Well, what do you do when life takes away your map and even your sense of self? Today on Lifejacked, the Resilience Podcast, I am interviewing someone who lived that very question and is rewriting the answer. I'm your host, Dr. Rowe, and the guest today is Chaandani Khan. 6 years ago, a brain injury upended Chaandani's life and led to persistent post-concussive symptoms, which we also can call PPCS. She went from being an outgoing, active person with a full social life, a demanding job in the fast-paced events world, and many hobbies, to struggling with basic tasks like making a sandwich or following a simple conversation. In the fire, she found a way to accept what was happening while still holding on to who she could become. Over time, through appointments, patience, and deep inner work, she rebuilt with intention. Today, Chaandani, is it Chaandani?
Mm-hmm. That's right.
Okay. Chaandani is an educator for medical and allied healthcare concussion practitioners, and she's leading systemic change in how concussion care is delivered. She also brings an artist's eye to the world, capturing patterns and shapes through photography, and still loves the behind-the-scenes magic that once drew her to events. Chaandani believes resilience is a skill we can learn. So we're going to talk about rebuilding identity, pacing, and cognitive load, the nuance of supportive systems in PPCS, which is, like I said before, persistent post-concussive symptoms, and what compassionate, effective care can look like. Hi, Chaandani. Welcome. Thank you so much for being a guest on my show. How are you?
Hi, Dr. Rowe. Thank you so much for having me. I'm doing great. I'm excited to have a great conversation with you.
No, absolutely. Now, tell us what life was like before your injury.
So this is a great place to dive in. I think it's really important to lay out that groundwork just so people can really understand the changes that I went through and what I endured after my injury. So prior to my injury, I was a very outgoing person who lived a very fulsome life. I worked 50 to 70 hours a week in the event industry, as you referenced, which I loved. It was very dynamic, it was challenging, and just nonstop in every way possible. I also was very social. I had hobbies. I was an avid volunteer. I've been volunteering since I was a child, actually. So that's been a very big part of my life. And I was, in my opinion, a good friend and a good family member in the sense that I could be very present with people.
So I have to ask you and, share what feels safe for you.
Mm-hmm.
So what changed for you after your injury?
So I went from living that how I described and very much also feeling like I was always I had a lot of freedom. If I wanted to do something, I would do it. If I needed to learn something, I would learn it. So on and so forth. But after having a concussion brain injury, I found myself suddenly not able to make a sandwich anymore. I wasn't reliably leaving the house with 2 shoes on my feet. I would genuinely leave the house and look down and see 1 shoe, 1 sock, and then I would just cry because I knew something was wrong, but I didn't know what the problem was. My cognitive state was not functioning as it always did, and I wasn't able to think about very basic situations or troubleshooting or strategizing the way that I always was. So these are just 2 small, well, not small at the time, but 2 small examples just to kind of share some of the changes that I endured. The types of cognitive deficits that I face and limitations, it bled into every part of my life. Mm-hmm. So, I wasn't able to work the way that I always had done. Having like lofty dreams and goals, that just wasn't for me at that time in my life anymore, which was a very hard pill to swallow, especially because I've always been such a driven, motivated, forward momentum type of person. I wasn't able to show up for people who I love and care about. I wasn't able to be really present with them for a variety of reasons. For example, I wasn't able to follow basic conversations very well. So if somebody was talking to me or trying to share something, all of a sudden I remember multiple times just stopping and being like, wait, were you talking or was I talking? And that obviously would very much get in the way of even touching the surface of what they were trying to share with me. Not being able to take care of feeding myself in basic ways and like understanding how do I make a sandwich. For a very long time, one of the skills that I had to practice was, well, multitasking, because that ability was very much affected for me. And, when I think back, it's actually quite a painful memory, but I just remember so specifically for months on end practicing the skill of boiling water while frying an egg at the same time, and so these are just, adding some color commentary to some of the changes that ensued after my injury.
Wow. I couldn't even imagine because, you're going along, like you said, you were this busy person. And if you were doing event planning, that means that you were multitasking and you were here, there, everywhere. Go get this, delegating this. I don't know. Do you remember this? And giving directions all over the place. Right. And so that was a very fast paced kind of, lifestyle at that point in time, because everything has to happen. And I'm pretty sure everything is important. And everything is important.
All the time, everything at the same time yesterday. Very important.
Right. And so I couldn't even imagine. And that your pace had to slow down significantly. I mean, to a point where it was like you were going fast like a jaguar or a cheetah, and now you're like a turtle.
Well, a turtle who sometimes was finding herself slipping backwards and not being able to control that, even like just slower than slow speed. Just the most excruciating thing for me was really just being at a complete standstill in my life. Complete standstill, not able to move forward, not able to work, not able to plan ahead, not able to keep up with friends and families and circles and events, because I also was a very social person outside of work and all my other commitments. So it was excruciating, feeling like I was just stuck in stuckness. That's a term that I've coined in the PPCS space.
Yeah, no. And so I had to ask you, in those early months, and I mean, you named a few things already that were extremely difficult, but on a day-to-day basis, what do you feel was the hardest for you?
Yeah, like that's a great question. And immediately I have all these conflicting responses, like not conflicting, they very much all coexisted, but conflicting in the sense that it's hard for me to say like, oh, this was the most hard. So maybe I'll just give you very high level, a couple of them that come up kind of together. One is the concept of stuckness that I mentioned, just being stuck. And for the first time in my life, unable to just make a change, to call someone, to do something, to learn something, to be able to continue moving my life in the direction I wanted it to go in. Another part was concussion and PPCS is an invisible injury. So my voice sounded the same. In my case, I didn't have any scars or any blood or any bruising or anything that would identify myself as operating potentially differently to the outside world. And that was extraordinarily hard, just knowing that how many cognitive deficits I was facing at any given minute or hour of the day, yet looking fine and automatically being treated like I was fine or expected to be just myself.
Wow. And within PPCS, which of course stands for, like we've stated it before, is the persistent post-concussive symptoms.
That's right.
And so that's, you've had a concussion or some type of brain injury, but you're still dealing with it some time after it happened, right? And so how does that show up for you? What does that look like for you in this present moment or even afterwards?
Okay, let's pull this apart a little bit. So I was in a car accident, and that's what caused this injury in my experience. And that was 6 years ago. So it's when I zoom out and I look at everything and my past 6 years from this point of view, I can very clearly see that there were different phases, if you will, like there was survival, like surviving just through the minute, just through the day, just through the hour, attending appointments, being willing to switch my mindset from I want to do all these things to today, if I sleep for 4 hours, that's a win. So, that's like an example of like one of the phases, if you will. Overall, I mean, concussion, and when you have PPCS, persistent post-concussive symptoms, that is not something that necessarily heals in a chronological way. This is something that, you might see improvements in one symptom. You might see a bodily system that's functioning better. You might, and it's kind of this really messy web. So it's really hard for me to sit here and say, this is exactly how things were at this point in time. It very much is a subjective experience for myself, but also if you were to compare people with PPCS, the experience is so subjective. I can say right now that, 6 years, it's been 6 years. It took me up until really last year to start to really feel like I had my cognitive wherewithal returning across different areas of functioning, so that I was able to actually think more like myself and be more productive like myself again. But that being said, to kind of cap this off with the very final part of your question, where I am right now, I am doing great comparatively speaking. However, I do like to lead with full transparency in all that I do. So there are still some things that I do struggle with, to be honest. Like one, for example, is fatigue. That's something that was completely life-changing right after my injury, directly related to my injury. And to this day, I actually am a person who does not know what it's like to feel rested anymore. I can't even imagine what that is. Like, it's just so far gone for me. So, that being said, I think it's also important to say that if I practice what I preach and, I show up in ways that work really well for my brain, I can be like very, very successful and very effective. It's just that, I know that there's a space that I function best if I'm playing within.
Yeah. It's interesting as I hear you talk, because I am a person who is very busy and just, I know that I'm very busy and my brain is going and going and going, and I get exhausted, and I don't have PPCS or any type of symptoms from anything.
Right.
But and I just get tired and my brain is functioning fully, and I didn't even think about, your brain is responsible for not just your thoughts and not just your actions, but your bodily functions.
Yes.
I mean, we have what they call homeostasis, right? So your heart is beating, and you don't have to tell your heart to beat. You don't have to tell your lungs to draw in air and to push it out. You don't have to tell your stomach to process and things to move down and, throughout your body. And you don't have to do that. You don't have to tell your body to do that. It just does it. But I couldn't even imagine if, after a brain injury, that's even something that you hope is going to work naturally as it's supposed to, and that is a real concern.
Absolutely. That was so well said. Like, so well said. That, like, I think what you just shared is so important for people to be able to hear and to really connect with. Sorry, just to jump in. I was like, I just have to say, I'm highlighting what you just shared. Yeah, no, and it's absolutely wild, because like yourself, like I would probably say you might classify yourself as a high achiever amongst many other things, like just highly capable, lifelong leader and learner, just like on the go, unstoppable, right? But then, you think about things like even the example of driving a car, for example. For people who have, let's say, driven a car for a very long period of time, generally it feels like it can be rinse and repeat. Like, you get in your car, you're going through your normal checks, you're driving safely, right? But when you have a concussion or PPCS and you go to drive a car, all of a sudden everything is so pared down. You all of a sudden are cognizant of thinking, well, what does green mean? What does red mean? Okay. This side is gas, this side is brake, and like also being cognizant of like having to filter out background sounds so that you can focus on the road and focus on driving, let alone have a passenger who's talking to you or listen to music or a podcast. So I just wanted to like add that in as well. Just like, it was just so deeply humbling, like learning this granular way of thinking about things that I took for granted. I'll put it that way.
No, absolutely. I could see where we definitely take things for granted. I mean, just like, you drive home because you take that, like you're saying, you're driving home, but you take that same route every day and you take it for granted. Because I know I've driven home and then I show up in my driveway and I'm like, how did I get here?
Yeah.
I didn't realize it, but I'm on autopilot, right? Exactly. But for anyone that is, dealing with PPCS, like you said, simple things that are supposed to be routine, that used to be routine, now it's like, no, I got to take some brain power and I really got to put it to work. And I could see how I don't know how you can get rest. I mean, I could see how you could be exhausted quite often. So with this new normal, right? With this new normal, does there kind of identity, like, or a self-identity, do you have like a struggle with that? Is there some kind of like, who am I now? Like with this new normal or how I'm functioning, do you struggle with that at all?
Absolutely. There was a time and place where that was a deeply painful experience and deeply painful journey. So what you're hitting on is absolutely huge. It's actually, I'm glad you're bringing this up because it's a part of the PPCS journey that I'm personally very passionate about speaking to. I like to just lift the lid so we can look at all those dusty corners that we don't often talk about. Loss of self is something that is extraordinarily common when somebody has PPCS. In a moment, I'm going to take a step back and just kind of give a little definition of PPCS so people listening can assign a time frame and just help understand a little bit better. If I don't remember that, please remind me. But I just want to say that, in my experience, it took me 6 months of no longer talking like myself, acting like myself, feeling like myself, to fully lose a concept of who I was. I was no longer on the same trajectory. I no longer had the same skill sets. I wasn't able to have these lofty dreams and goals to continue driving myself forward to different areas. And I didn't know. I'm like, it's fascinating because like when all these things that we externally define ourselves by, when those are all stripped away, it's a very deeply sobering experience of, well, who am I if I'm not this that I've always known or that I thought that I knew really well? So that's through the lens of my own experience, but I share that on my behalf, but also on the behalf of thousands upon thousands of others who are actively going through that right now or who have gone through that. And what you're faced with, at the time, I was still just focusing on attending tons of appointments every week and just trying to make meals and trying to just do very basic things in my life without sleeping my entire years away, right?
Yeah.
And so I didn't really have time or the cognitive wherewithal to actually sit down and introspect and think about the gravity of being in that position of losing a sense of self.
Wow.
Yes.
So,
and as you mm-hmm.
Well, I was just going to ask, so what does that process look like? Because you said it was a whole lot deeper and, you really struggled with it earlier on. I see that it seems like you've kind of developed a process to work towards it. So what kind of things did you do to rebuild or, in a sense, become comfortable with who you are now?
Yeah, really juicy question as well. I hope my answer is just as juicy. So, I mean, it's like, I wish that in the experience of PPCS, I wish that it was as simple as like a 5-step process. You just do X, Y, and Z, and then you'll just build back and it will just be great. And you'll just feel like yourself. But the truth of the matter is that it can take people months, it can take people years to even accept the fact that their old self is an old self and it's not the one self that you've known. It's a concept that really it bent my mind for many, many years. So, there's a couple, as far as like, quote unquote, what I did, there's a couple things. On one hand, I, went through a lot of therapy, both, physical therapies, as well as I attended talk therapy. I also took myself on a very deep personal growth journey, which for me is one of the biggest pieces when I'm asked, what's worked the best for me. One of the biggest pieces is going on an acceptance journey. As you know, in your line of work, like that does not happen overnight. That's definitely a process of its own. So that's part one of what I did is I went on, a lot of multiple types of therapy, plus my own personal acceptance journey and process. And then, once I was, able, this took years, by the way, this took many, many years and probably up to last year to really process. But then, once I had more of my cognitive abilities back in different areas, the second thing that I did was start to get back to some of these things that brought me a lot of joy and forever did. And this is such a privilege that I now recognize it is such an incredible privilege to be able to take part in activities that bring you joy. Because I experienced the other side where I didn't have that privilege anymore. And it was something I took for granted. And I think it's important also to kind of tell people this, right? And so in short, one of those things for me is photography. I've always been so lit up by capturing patterns and shapes and sometimes capturing streetscapes as well. And so that's something that this is in New York. This is an older photo of mine that I have hanging, but it's one of my favorite ones. I also love like capturing like moodiness, like there's a bit of mood in this. So photography is something I've always felt very anchored into self. And it's one of the times that I feel the most me. And so as you can imagine with what I shared before, this is a horse named Billy, captured, kind of through the fence. I'd also like to say that both of these, like, it's a photo of something hanging on my wall. And so for people, if you're looking at these, I'm like, please know they look better in person. I did not edit the photo I took of them. But yeah, all this to say that, when you think about what I described as far as losing a core sense of who I was and what I was here on earth to do, being able to finally get to a place where I was able to be existing in what I called like a current self, which was not my old self, but being able to do something like photography that brought me this like deep feeling of me was very impactful.
Yeah, I mean, those are beautiful photographs, and I'm pretty sure that you have many, many more. But thank you so much for sharing those few photographs with me on the show and with the audience and the listeners and the viewers. Of course, the listeners can't really see them. Right. If they go over to YouTube and watch this episode, they'll be able to see the beautiful photographs. But, I commend you and finding your silver linings and finding your lemonade right out of the lemons, because it is hard. I can think of the few times when I've had, minor setbacks health-wise, and I can't go and, function like I want to. And it's very frustrating. But you do have to find things like you have done, which is the photography. But the one thing I do love that you are doing is educating people. I'm in education. And so anytime there's anyone out here educating others, I think it's simply fantastic. And so one of the things I want to touch on first is there are a lot of caregivers for people who have PPCS. And I know that as a caregiver, you don't always get it right. And I know each person is individual and their recovery is different, right? Each person, because they're an individual. But what are some things a caregiver can do to help?
Yeah, I'm glad we're going here, because you're right. The role of a caregiver is varied. It's challenging. There's so much to it, especially if you think about a caregiver caring for somebody who has concussion and maybe PPCS. Perhaps they've known this person to be one way for maybe their entire life, and all of a sudden this person is not acting that way. This person maybe has a shorter fuse. This person is struggling with things that can't visibly be seen. So, whether it's that case or maybe not knowing someone that long, the best thing I think that anybody external to somebody with this injury can do is to specifically not ask the injured person the question, "How are you?" And that might sound a little counterintuitive, but I want to unpack that a bit for us. So, how are you is a question that, in my experience and my best assumption, is always meant in a really positive way. However, when you are going through something like PPCS, again, battling your brain and your body in so many ways, some that you're aware of, some that you're not even aware of at the time, it becomes a very loaded question. And, one of the biggest things that I personally struggled with was not having an end date in sight. And I lamented and I struggled and I complained and I cried and I was so distraught over not having an end date. So if I connect that back with someone asking me, "Oh, how are you?" Instantly my mind is like, "Oh, well, how was I compared to an hour ago, to yesterday? When am I going to be better?" And it's just a spiral. And this is actually not unique to myself. At this point, I've heard from hundreds of people who have gone through the PPCS experience or currently are going through it. And this is a major, major one. So I really like to share that point and just say, in place of that, a suggestion is, to create, if a caregiver is wanting to show care and show support and show love, just find a way to make it a very narrow ask. For example, instead of saying, "Oh, you went out for lunch today with a friend. How was it? Was it great?" And just asking a lot of bigger questions. Maybe it's like, "How was your meal at lunch?" Something that feels so small and so doable, really, for lack of a better way of saying that. If you're looking for more of a general "how are you" check-in, maybe you can actually narrow it down. If you're visiting someone maybe and you stop in, you're like, "Oh, how has your morning been? How did your therapy session go today?" Again, just making it very bite-sized and manageable is really helpful, and it helps to prevent the person with PPCS or concussion from just spiraling on a level of like, "I actually don't know how I am," from hour to hour.
No, yeah, I think that for most of us, myself included, all we know about concussions is, someone hits their head and then they say, don't let them go to sleep for 24 hours. And then you're trying to keep them awake and they're just like, oh no, don't go to sleep. And that's kind of the extent of it. And then you just move on with your life when the person who has the injury, right, that's not as simple as it seems, right? And
no, it's not. And I kind of started laughing because I love your energy. I just kind of pictured you coming into someone's room being like, don't do that, don't sleep.
Right. And it's like, okay, that probably not helping.
Probably just like that. Which it would keep me awake, let me tell you. Actually, I just wanted to say that is an older way of thinking. And this is what's fascinating about the concussion space, is that there are these more antiquated beliefs that the general public, they need to have new education, and they need to know how are we treating concussion now? How are we practicing? Because, if someone doesn't come directly from a sport background or medical background, then they might not know. So for example, it's not treated the same these days as it was then. Even growing up, I remember people being like, you have to wake someone up every single hour. And what happens? You have a concussion means you hit your head and you have a headache and that's it. But nowadays we know that you actually don't need to have a physical hit to your head. It can be very much like a fake injury. And that's how concussions are also caused. Absolutely. There are all these, we know a lot more now. We still don't know enough. I'd like to put a big asterisk to say that there's a lot of people in incredible positions doing amazing work to forward, whether it's, research or just interest or changes in sport or changes in medical. But we still just don't know enough still.
Right. But you have mentioned that there are some gaps in concussive care. And so you mind sharing, you did talk a little bit about it just a moment ago, but what are the gaps, that we have right now?
How long do we have on this show? There's a staggering amount of gaps that patients face. Of course, as you know, at this point, I had the privilege of viewing them and experiencing them firsthand in my own recovery. I referenced before that at this point, I've heard from hundreds of people, and I won't go through a massive laundry list, but I will just say that the concussion recovery space is, again, it's riddled with gaps. So first off, I often get asked, well, isn't there standard care? Isn't care standardized? Isn't there a guideline, a set of guidelines that people just follow? And yes, I say respectfully and cautiously, yes, guidelines exist. Yes, standardized protocol exists. But what we commonly see is that there is variance between how one provider versus another maybe rolls that out. There's also variance between how much one provider, I guess, maybe has experience or has support for perhaps certain aspects of what can ensue from concussion and PPCS. That's just one type of variance that exists. So you're looking at maybe, the type of referrals that they make can be based upon some personal variance. Type of referrals, the frequency of referrals, whether or not somebody lives in an area that does have concussion clinics. And further, do these concussion clinics, do they follow the latest studies? Do they follow the latest protocol? That's just some of the pieces tied into the more clinical side in a very high level perspective. But if we look at the actual patient perspective, which is where I specialize on the patient perspective, lived experience lens, there are a lot of gaps in for example, just, not really being understood. Maybe we'll cover this, maybe we won't. I will let you guide the conversation. But in what I do, that is one of the issues that I'm working to solve. So often what I have heard from individuals with PPCS. So that means that they struggled with concussion symptoms for a few weeks, a few months, or a few years. It can be a very long lasting time, just depending on personal factors. But that means that somebody with PPCS might be going to all their appointments. Let's say they're going to their physio, they're going to their chiro, they're going to their athletic therapist, they're attending osteopathic treatment, they're getting acupuncture, so on and so forth, for example. But are they actually being understood at the appointments? Are they in a place with their own, perhaps their cognitive functioning in various ways to really express all that's going on? Is the provider able to actually extract the correct information so they can create a treatment plan that then helps the person? This is something that specifically providers have identified to me having a really big challenge with the concussion population versus somebody coming in perhaps with an arm or leg or other bodily injury. So this is just kind of me skimming the surface, trying to give some of the, some flavor on both sides of it. But it really is a space where I believe there's so much hope at this point in time, and things are going in a great direction. But there are so many gaps systemically that the patients end up facing.
Well, I commend you, as I have throughout this interview. I mean, and so when you are helping practitioners, what exactly does that look like? Because I know sometimes people who are medical professionals are kind of like, okay, I'm the medical professional. I went to school for this. I know all about it, and they want to be the expert on it now. And I'm not taking that away from them, right? But when you have someone who actually has experienced what they are treating, I do feel that there's a lot of value in that. So how do you work alongside the practitioners?
Well, thank you for acknowledging, and I'll join you in acknowledgement that, professionals who have gone through all this education and dedicated their life and their time and their energy to developing expertise, we need them exactly where they are. I am not here to replace anybody at all. We need you where we are, but what we're starting to see more and more, and just really identify, is that we actually need someone who's able to help the professionals build out their knowledge in means of understanding more of the patient perspective. And so what I do specifically is I help, I help professionals by providing educational workshops. So the professionals that I'm speaking with, there's been a very natural fit for me thus far with physiotherapists and chiropractors specifically, or as physical therapists, also known as physical therapists. And, what I'm doing is I'm coming in, and at this point in time, I've gotten pretty familiar with the pain points that they face when they're serving their concussion population. And for certain therapists who are treating either a high volume of concussion patients or specializing with concussion patients, there are, again, it's a very specific set of challenges that they face. And so for me, I'm kind of acting like I'm able to translate between the patient experience and their pain point. So I'm helping them bridge that gap, if it makes sense. The professionals that I work with, I also, reaching out to anyone who's a doctor, a nurse practitioner, osteopath, acupuncturist, so on and so forth. There are so many incredible professionals who treat these patients. So what I'm doing is I'm providing that continuing education piece for individuals who have a vested interest in serving this population. At the end of the day, one of the bottom lines I'd say is patient outcome. And that's something that, from my understanding, from what I've been told by various professionals, that this is something very high on the list, to make sure that they're actually addressing. And I guess at this point in time, I'll share. So PPCS, persistent post-concussive symptoms, what we're seeing is that 30% of concussions become persistent. And that's why they become labeled as, or that's when I should say they become labeled as PPCS. Now, the general expectation from medical community is that concussions will heal in a few days to a few weeks' time. And when they fall outside of that, that's when, hands are thrown up and saying, well, it's persistent now. So 30% translates to thousands upon thousands of people. And so my own curiosity here is, okay, well, what's contributing to this? And of course, I have to acknowledge there's pre-existing conditions, there's personal factors, there are variables at play. But in my mind, I'm wondering, how many of these cases are still remaining persistent because the professionals who are trying to help the patients aren't necessarily able to fully meet them where they're at. Not for lack of medical knowledge, not for lack of expertise, for lack of literally not living that experience. One more thing I will add, as an example, when I work with physiotherapists or physical therapists, for example, multiple people have identified this for me. And if there are any listening, you probably will relate as well. But when working with the concussion population, it can be very challenging to extract what exactly is going on in means of having that therapist create a plan that will actually target what the patient needs. And so for me, it's very easy to look at this type of interaction and say, well, maybe the reason you're experiencing high patient drop-off or, low rate of follow-through with at-home exercises is because the patient is cognitively having more challenges than you're aware of. So, if we break this down even further around the lines of communication, that's a huge piece that for me, I have a very solid understanding of communication challenges that a patient might be facing and how that would affect in clinic behavior. So long-winded way of I just wanted to really express, what's going on in these sessions, how I'm able to actually be that bridge and provide that piece that's so desperately needed.
Yeah, it's interesting because I think that for most of us, we relate brain injuries and concussions to sports, right? And not even thinking about like yours was from a car accident or anybody, they're skiers sometimes that hit their head.
Mhm.
And we don't ever think about it because we feel like, okay, it's a one-off, right? So you hit your head, it's a
Mhm.
one-off. And, you provide care, post care. And then, like you said, and maybe it takes a few days for it to heal. Maybe it takes weeks. And then, but I think most of the times we're thinking repeated brain injuries, we think of football players. And then, of
Mhm.
course, eventually they find that they end up with CTE, but they
Mhm.
can't discover it until
Mhm.
they're deceased, which is awful. And
Yeah.
hopefully that type of, developments in as far as technology and medicine, hopefully that will advance as well to try to see if they can combat it right before.
Mhm.
But,
Mhm.
there's so many things about brain injuries. I mean, there's still so many things about the brain that we don't entirely understand and that we're learning
Mhm.
all the time when it comes to neurology. But, it's just interesting that even just a one-off, right,
Mhm.
can cause such a drastic difference in how we function. And I feel
Mhm.
like hopefully viewers and listeners are really taking heed to this conversation because again, most of us think about repeated brain injuries, like I stated
Mhm.
before,
Mhm.
athletes, and repeated times that
Mhm.
they're hitting their head and then they're concussed.
Mhm.
But your experience and also many of the, you know, individuals that you work with, sometimes
Mhm.
it's just a one-time incident. It just
Mhm.
happened one time. And after
Yeah.
that, your life is changed and you have
Mhm.
to learn how to function differently. And it may not heal for you in a few days.
Mhm.
Like you said, it may not heal
Mhm.
for you in a couple of months. It
Mhm.
may take years.
Mhm.
And hopefully, the advancements in medicine and people and caregivers can be patient and really, recognize that because like you said,
Mhm.
you don't have scars that are visible on the outside.
Mhm.
Everything is going on the inside. They're not going to cut you
Mhm.
open to diagnose it.
That's right. And like that's a whole other can of worms and means of, testing around concussion. It's
Yeah.
very challenging. It's extraordinarily challenging. The tests that we have now are not quite enough. There's, a reliance on subjective response. Subjective, sorry, what's not response? Subjective reporting. As well as other assessment tools. But it also, I believe it does take a professional who specializes in concussion to really be able to see between those lines.
Yeah.
And you're right. It can be a one-off. Concussions are also cumulative, so there's that as well. If you have had multiple, and also one more little wrench I'll throw in here, which is totally true in this space, is that concussion is a very much an underdiagnosed injury. So it's possible that somebody, like you were referencing, someone who is like, oh, I've never had a concussion before, they might have. It might have been just not diagnosed. It might have been missed. It might have been missed by them, by medical. This is like an established fact. So it's a messy space.
Yeah, it can be. I mean, I imagine some of us who probably walked into windows or glass doors and
Yeah.
not even thought about it. Like, I may have had a concussion. You don't ever
Right.
even know. I mean, I'm laughing. It's not funny, but it's just like I think
Just
about
like
these
the
different things,
human.
that happen, and you
Yeah,
don't
yeah, that we're not even thinking of. And this isn't to
right,
say like I don't want watchers to come away from this thinking like, oh gosh, this is really doomsday. We don't, neither of
right.
us mean it that way. When you said
No,
take heed, I was like, absolutely, people should take heed in means of thinking like, yeah, maybe I will wear that helmet. Maybe I will, take extra precautions. Maybe if I hit my head or suspect that I've had a shaking type of injury, maybe I will just get checked. Like these are the things that I would love for people to take heed from. And on the note, I just also like people to know, like just to empower as many people as we can with this like knowledge.
yeah.
Yes, if you do suspect that yourself or somebody around you has had some type of injury that could affect their head and brain, have them checked. Most people naturally are like, great, I'm going to a GP, I'm going to a general practitioner, a medical doctor, which is incredible. However, I recommend that you do that, whatever, if that feels right for you, but also seek a physiotherapist who has specialized training in concussion. Because it's my belief that, well, my belief, but also I've seen this in my own experience. I've heard this from many others as well, but physiotherapists, for example, who have gone above and beyond to seek additional training for themselves, they are the best. They are very well positioned to be able to even flag other symptoms or refer you out. So I just want people to feel empowered that if you feel this might be an issue, then just get an opinion.
So I need to ask you a question because you're in Canada, correct?
I
And
am.
so, and of course, which is an entirely different country than the United States, of course. And and I don't know how much you know about the United States and healthcare. We kind of have a struggle with offering healthcare,
Mm-hmm.
and
Mm-hmm.
really making the patient the center of the medical field and
Mm-hmm.
this industry. Do you feel like, and I don't want it to be too heavy of a question,
Mm-hmm.
but I do know that Canada does very well when it comes to healthcare and taking care
Mm-hmm.
of its citizens. I mean, I absolutely admire you all with that. And so, do you think that what are some things that we could perhaps learn
Mm-hmm.
from Canada when it comes to progressive care or supportive care, especially with concussed individuals?
Mm-hmm. Okay, yes, a delicate question that will not be too heavy. Agreed. The first thing that comes to mind to share is that yes, I am based in Canada, but actually my network is across the U.S. as well as Canada. Very specifically, it might even be a little bit more across the U.S. right now, to be very honest with you. I always say that brain injury is not geographically limited. So for me, whether I'm serving practitioners in Canada, serving in U.S., perfect, great. Let's just help as many people as we can at the end of the day. So that's part one. Part two, I do want to sort of tiptoe away a little bit from anything like that could skew political or anything between the countries. But I will say if I look at this in a hyper specific way, how, as far as supportive care, specifically in the PPCS and concussion space, this for me looks like one main thing. If you are in a profession where you are serving people in any way, you're helping people, serving people with concussion. This could be people who are, again, they have a medical background. This could be people who work in allied healthcare. This could be people who work at a nonprofit that provides services to people with concussion. It can come in many shapes and forms. And one of the most important things that I believe is you must equip yourself with knowledge, a little bit of knowledge on the lived experience. And I want to be clear when I'm saying this, because I'm not suggesting that anyone in any of these roles or another role needs to do a deep dive and become a subject matter expert on what is it like to have PPCS or concussion. I specifically mean to bring someone like myself in, might be biased here, whether it's myself or someone else providing a similar service, but bring us in to be able to help you translate education provided from schooling or books into real life, just enough so that you're able to really meet that patient where they're at, meet that person where they're at. To me, that is what supportive healthcare looks like, specifically around concussion and PPCS.
Oh, I love that. I love that. So I have to ask you, with the work that you do, you have a company called Return to Life.
Mm-hmm.
And so please share, and of course, it's centered around the work that you do and the things that we've been talking about PPCS, but anything that you haven't shared about Return to Life, please share it with the listeners and the viewers.
Okay, well, I'd love to. Thank you. Return to Life, I mean, if I do say so myself, aptly named. This name, fun fact, I guess this name came through for me because it's something that, going through the experience of PPCS myself, and again, hearing from hundreds of others, this is one thing that people are just so desperate to be able to do. I've heard it so consistently. I just want to get back to my life. I just want to return. So for me, that is how I named the business, which maybe that's a fun fact, different angle for us to explore here. Outside of that, Return to Life is a specialized practice that helps medical and allied healthcare practitioners learn to meet their patients truly where they're at, so that we can together, we can come together to provide the overall patient outcome that will help people recover and move forward.
Wow. Well, Chaandani, sorry.
Got it.
Yeah, sorry about that, but this has been such a great conversation. And it's hard to believe that we've come to the end. And so I have to ask you this final question. And that is,
I'm ready.
In your opinion, what is the best way to build resilience?
Okay, the best way to build resilience immediately comes to mind. The first thing one must do is to find courage from within to sit with the hard things, sit with the pain, sit with the feelings, sit with the hard thoughts, sit with the hard situations. Just find the courage to be able to do that, to sit with it and just coexist. Part two is that, the whole concept of you have to feel it to heal it. That's part one. You're feeling through it. Part two, it's important to sit with it, but just don't stay there for too long. Find ways for yourself to start processing, to start working through things. If you need to feel the hardest of feelings and just be miserable and just cry, do that. I am such a big proponent of just letting it move through you. And I'm not saying that you're going to cry once or twice and everything is all fixed. I wish it worked that way. It doesn't. But being able to find that courage to take that step, that is what will move you forward into finding different levels of healing, different levels of acceptance, and therefore being able to come out the other end, whatever that looks like, and know within yourself that you did make it through. That is how you can start to build resilience.
Wow. Well, Chaandani, thank you for your honesty, your clarity, and your courage.
Thank you.
Your story shows that resilience can be learned through acceptance in the fire, intentional rebuilding, and the right kind of support. So as we wrap up today's conversation, yes, I hope the viewers and listeners understand better how to develop the skill of resilience and rebuild their identity after a setback. And also, I hope you learned a little bit more about concussions and PPCS if you ever find yourself in that situation or you're a caregiver for someone who ends up having some type of brain injury. Do you have any last words of encouragement for the listeners? I'm sorry, let me go back. Lastly, before we sign off, how can listeners or viewers connect with you?
So my website is returntolife.ca. Please check it out. If you'd like to drop me a message, there's a box. You can just go directly from there. Also, I do use LinkedIn as my major platform. So if you'd like to follow me there and follow me along the journey of creating change in the delivery of concussion care, I would love that. If you are a practitioner, please feel free to drop me an email or connect with me on LinkedIn as well.
Fantastic. Do you have any last words of encouragement for the listeners or the viewers?
Yes, I do. If you are a person who is struggling with PPCS or know somebody who is, just know you can and will move forward. It may look different than other people. It may be in a subjective way, but it's my belief from my own experience, from what I've heard from so many other people, that these little changes consistently will add up.
Wow. Thank you for sharing your extraordinary story and practical advice on Lifejacked, the Resilience Podcast. I want to wish you and your family nothing but blessings and abundance. Please take care.
Thank you so much.
Give me just a second. Chaandani Khan, everyone. Be sure to join me next time for more uplifting stories and insights on resilience. Until then, keep pushing forward, embrace the journey, and remember that every setback can lead to a greater comeback. Dr. Rowe, signing off.